physicians are typically not the best of patients because we all underwent the same basic medical education and we think that we know everything what everyone else does as well. My name is Bernd Wintersperger. I'm a cardiovascular / a cardiothoracic radiologist at the Joint Department of Medical Imaging. While traveling on a family vacation, I started to have some abdominal or upper abdominal pain. I do have a family history of colon cancer, which my dad had. And obviously I consulted with my family physician, who got more and more worried. And we said, okay, given the location, we may just not only do a colonoscopy, but also add a gastroscopy. But first, what we should do is ultrasound and also CT imaging. Well, I guess it's not that the family physician is the first who gets worried. It's yourself who first gets worried. You always have the bad things in mind. You're always thinking, oh, what could be worst case scenario? I've been trained in CT imaging. I've been trained in ultrasound imaging during my residency. So I knew about the details of those scans, how they happen, how they're being performed. So this was nothing novel to me at all. Becoming an abdominal patient for me, where you not really know what's going on in your body, it's slightly different. Your fellow colleagues know exactly how to report those studies. And so you're depending upon them and finding the right interpretation of those scans. From that perspective, it was something entirely new to me. My medical knowledge and experience did not prepare me for the time of uncertainty between finishing the scan and waiting for the result or the report of the scan. You had the test, but you're somehow fearing the result of the test. And you have your background knowledge and you always fear the worst. Once the result came back, I was really relieved that everything was, at least on a CT scan, entirely normal. The findings finally were found during the gastroscopy. Personally, I think knowledge or grades do not make you a great doctor. It is something more than that. It's not being able to learn from books and also keep that knowledge. There's way more to that, which is the empathetic side, the emotional side, which is more often learned in daily life outside of med school.